canopies down there we can hide under. And then this afternoon, we're canceling the kayaking and swimming due to the weather. So we're going to just meet here at the pavilion. We're going to have some alternate activities at 1 o'clock. Possibly extremely fun, hiking in the rain, games. That's what we're thinking.
Thank you, Christy. As our new swag patch says, this is not your daddy's bumper show. We like having the kids involved. We like having women on stage, and we like having family events. So it's not just guys with beards talking about bags. Nobody wants to hear that anymore. So without further ado, I'm going to bring up our first speakers, plural, of the day. We have Ashley, Maggie, and Kristen. Come on up. These are our midwives. This has been a highly requested class. So for the first time, we have midwives. Enjoy.
Hey everybody, I'm Ashley Cavender. I'm a certified professional midwife. This is Kristen. She's a doula and student midwife, and Maggie is a doula. And so all part of the team, and glad to be here with you guys. So we're hoping this will be a little bit participatory. If you have any questions, please raise your hand so we can go through them at the time and also answer questions at the end. Has anybody here had a home birth before? Yeah. Way to go. Same. Let's see. Okay, so first we're going to talk about why have a home birth. There's a lot of reasons, and it's hard to fit them onto one slide. But first off was respect for the natural design for birth, which reduces the chance of complications. The more you interfere with the design for birth, the more chances you will introduce complications that wouldn't have been present otherwise. Having a calm and supportive environment with a team of your choice. I firmly believe every mom and baby deserves a calm and supported birth experience. And yeah, you would be quite surprised to contrast the calm in the home birth experience to a hospital birth experience. Even under some of the best hospital birth experiences, it's a lot more frantic. And even in complications in home birth, it's a lot more calm in how it's handled. And every now and then there's parents who didn't even necessarily realize that there was a complication because the midwife is calmly managing it. So facilitates labor hormones, thinking about oxytocin primarily, which is the hormone that causes contractions. Oxytocin is actually the love hormone. So in intimate connection and darkness and time with your partner, those are the times when those hormones are facilitated. When you're uprooting somebody from their comfortable environment and taking them to a sterile place with bright lights and strangers, then it's very disruptive to the normal hormones of labor, which often leads to more intervention of introducing synthetic oxytocin, for example, because the hospital system needs to get people in and out. And so they want things snapping along, and you've already disrupted the process. And so they're introducing more interventions to help things progress in their timeline.
There's actually a really great theory that the very first intervention that you have in a non-home birth is leaving your home. So even if you're having a hospital birth where you're planning to have minimal interventions, just the act of leaving your house is in itself an intervention.
Yes, definitely. More connection to your body, your baby, and spiritual engagement. And this one is obviously when you're unmedicated and in a familiar environment where you're not distracted by everything that's going on around you, you're really able to engage with the process a lot better. And as far as with your baby, when you're having things like an epidural, it's disconnecting your body from your baby as well. And your body releases natural hormones that help support your labor process, and also those hormones transfer to your baby. So when you're experiencing a normal labor process, your body is producing hormones that help your baby to cope with the labor process as well. And so when you're disconnecting your like pain response, for example, from your baby's experience, then they're not getting that same wash of hormones to help them with the process as well.
It also makes it a lot harder to be able to tell where you are in the birth process, right? Nobody's labor is going to be textbook, but there are different signs and symptoms that people like us are going to have been taught to see, where we can walk into a labor space and say, oh, they're doing this, this, and this. This is probably what's going on with their labor. And that's why you need so many interventions in the hospital, because once you disconnect that, you stop doing those things. I kind of joke that when I go to a hospital birth and they give somebody an epidural, I feel like I'm putting blinders on. I go from being able to read a labor and see what's going on and get a lot of reads on what's going on, not just with mom, but with baby, based on how she's moving, what she's saying, what she's doing, to nothing. It's just completely quiet. So they need all of those monitors and medications to keep you on track, because they literally can't read it. They've got blinders on. And the only way that they can do is use machines, which is not nearly as good as being able to just read what's going on with mom and read her presentation.
And on that note, in the home birth setting with midwives, we are so familiar with normal labor progress and what a physiologic labor looks like. In the hospital setting, most OBs have not seen a normal physiologic labor. They haven't sat with labor. And so it's a very different perspective, because they haven't seen what a midwife's seen. They don't know really normal. Well, that's what midwives are experts in.
Which is another plug for people who are in your community that have been to births, such as your own mother or a sister that's been through lots of births or has training in it, to be able to come and support you and give you information as well, because they know normal and they know you. So they can be a huge asset to your birth space.
Yes. So also avoiding unnecessary medications and surgeries. You're less likely to have complications that require, like cesarean, for example, if you're planning a home birth. And even moms that are planning a home birth and end up going to the hospital still have a significantly lower chance of getting a cesarean than moms who plan to have a hospital birth from the beginning.
And I attribute a lot of that to prenatal care and nutrition and the health that you have in yourself going in. And then also, most midwives are going to transfer with you. We don't drop you off in the hospital parking lot and then go about our day. We're coming to. So we speak med. So if somebody is trying to come in and say, oh, we just want to top you off with a little pit in you, I have no idea what that means. We say they want to give you a synthetic oxytocin. It's a medication instead of what's actually happening in your body to speed things up. And you can say, oh, no, or you can agree to it, but it's informed consent, and that informed consent is going to help you achieve the birth that you're wanting or that you need.
But also, home birth clients tend to be more educated prenatally about pregnancy and birth and postpartum care than hospital clients do. Do you want me to keep going on this, or should we go ahead? Okay. OBs in the hospital system, they need to be in and out with their clients. They don't have time to educate you, nor do they really educate on physiological birth anyway. They want to more educate you on what an epidural is like, assuming that most of their clients are going to receive one. So the home birth clients, even if we do have to transfer, they come in more knowledgeable, more aware of what they want to say no to, what they want to say yes to. So they can kind of speak for themselves a little bit more so than the average hospital client.
I added a smoother start to breastfeeding for a variety of reasons, starting with, like, in the hospital, they're typically going to provide a lot of IV fluids, which can make it harder for a baby to latch postpartum and cause the baby to have more fluids that drop postpartum. And so their weight looks like it's dropping significantly more than it is, because they had the extra fluids that their body didn't need. And also, if there's medications involved or cesarean birth, then the medications can cause challenges for the baby because a lot of those medications and some levels are transferring to the baby, which can make it harder for the baby to be like alert and engaged with the feeding process, um, and harder for the mom to be alert and engaged with the process as well.
Home birth breastfeeding success rates are, generally according to some studies, around 97%. It is much, much, much higher if you give birth at home. And we believe a lot of that has to do with the hormones. It has a lot to do with how knowledgeable your providers are going to be at home, and that we do a lot of prenatal education. I'm huge on educating before a person goes through the labor process, because trying to educate after when you're tired is not the best time. And that's really more how they're doing it in other settings.
And we're not going to be like, oh, why don't we just give your baby a bottle and you can get some rest or something?
You're not
like
making
that. It's
real
a very
milk
different
yet.
environment perspective, and so the kind of support you're going to receive for breastfeeding is far superior. All right, so preparing for birth. I made this a short list for you all. One of the biggest things for preparing for birth is educating yourself. Reading, talking with people, finding what your best options are for your situation, which in my disclaimer, I'm not your midwife. I am a medical professional, but I'm not your midwife. I don't know the intricacies of your health. And so nothing that I'm talking about is specifically relating to your personal circumstances, but is good general knowledge. So yes, those are some of my favorite education materials there. But there's a lot more really excellent resources. And so that's the biggest thing to prepare you for the next 4 items on there is education. Next is choosing your birth team. This is very important to decide what kind of care you want to receive. And obviously, we are huge proponents of midwifery care. But what that looks like, each midwife is going to be individual as well, and finding the one that you connect with the best that's going to serve your needs for your birth is very important. So knowing what is the skill set of your birth team, knowing if you want to know what their credentialing is, their experience is, all those kind of things can be important for making your decision.
Yeah, and that's one of the reasons that educating yourself is so important, because if you go in to interview your birth team, because you are hiring them, they work for you. We work for our clients. Is having really good questions to be able to ask them to see if you connect with their answers. How would you handle this situation? And does it line up with how you would prefer for it to be handled? And asking them things like what can I expect? Open-ended questions can be really helpful for picking your team, because then they don't know, they can't tailor their answer, which a lot of people do without even thinking about it. They're not even conscious of the fact that they are tailoring what they're saying to what you want to hear. But that can really help you hire a team that is personalized to you.
In line with your values, for sure. And making sure that they're providing equipment that you want to have present for your birth, for example. And we'll talk about that more when we go over midwife things. But, what's provided might be a little bit different provider to provider. And so that's important. Preparing your mindset, because the biggest work of labor and birth is in your mind. And having the right mindset, knowing your why going into it is really important. And yes, it's really hard work, and being prepared for how am I going to cope with this process, what's going to take me through is very individual, and finding your own brain space that's going to help you get through.
Yeah, and I would add for people in here that would not be the person who's giving birth, but would be supporting them either in the home or through their pregnancy and after, your mindset is going to be equally important. We really absorb a lot from the people who are closest to us, that are the support people, and having the right mindset in the birth space, in the pregnancy, in the postpartum is huge, and it can make a really big difference in success or not.
I was just going to add your reasons for why you choose to birth at home. I like to go over that with every client, because when they're in their tough moments, when they're in their phase of, I can't do this anymore, I want to be able to turn those reasons for why back on them. But you know that you do not want to be in a hospital setting. You do not want the bright lights, the beeping, all the machines, the system that you have to follow in the hospital setting. I like to turn that back around on them and remind them of their why when they're in a tough moment, to help keep them at home. And being able to choose a birth team that helps fight for you and fight with you in those ways that align with you is also why it's important to choose your providers.
I also wanted to add, I'm sure everybody here is really great at ownership mentality, because that's all that we're learning here, is taking responsibility for our own health, our own care, our own lives. And that's huge in home birth. It is a team effort. You're not sitting and having somebody tell you what to do as your provider and you listen and do exactly what I say. You are part of the team. In fact, you're the decision maker, and we are the information givers and the supporters. And so that's really big in home birth, and one of the reasons that some place like this is where you're going to meet a lot of people that would be really great home birth candidates and home birth support people, because you already have that mentality, and it really fits perfectly in with this.
Yeah, I was thinking about with my own births, one of the things that I even said in my birth plan was I want to be queen of my birth space, because that's really the hierarchy in home birth is so different from the hospital setting, where people just listen to whatever the doctor is going to tell them in the hospital. Well, at home birth, the mom's in charge. So making healthy choices, the healthy choices you make during pregnancy make a huge impact on your birth and your health long-term, your baby's health long-term. We're going to explore that a little bit more in a couple of slides. But that is important. And another benefit of midwifery care is we are discussing more health practices that prevent complications down the line. And so midwifery care in and of itself, that prenatal care, is preventing a lot of complications. And then preparing for postpartum, this is one of the most underappreciated, one of the most underappreciated parts of birth prep is people prepare for the birth and don't even think about what happens postpartum. And that's a very vulnerable time, very important for moms and babies, and having that connection, finding out who's the right people to have in your space, who's the people to not have in your space, what are kinds of keeping yourself fed when you're nursing a baby all day long, really having the support that you need. And that's another place where midwifery care is incredible, because for moms postpartum in the hospital setting, once they leave the hospital, they are not getting another checkup until 6 weeks postpartum. In midwifery care, typically we're seeing them like 4 more times than that, because we're seeing them the day after their baby's born, around a week or so postpartum, 2 or 3 weeks postpartum, around 4 weeks postpartum a lot of times, and 6 weeks postpartum. And so unfortunately in the United States, we have some of the worst maternal mortality rates, and I really believe that the inadequate postpartum care for moms plays a role in that.
Yeah, mental health and postpartum is huge. It's actually the number one factor for maternal mortality, especially in Kansas and Missouri. Up to 80% of the maternal mortality deaths that we see in Kansas and Missouri are directly attributed to mental health and the support that they're receiving in their home. So it's huge.
Yeah.
What is the difference in the postpartum care? Like, how many days do you guys recommend that a mom stay in bed? And then like, I think you guys have like a regular go-to thing that you say, like how many days in bed, then how many days around the bed, and then and like why that is, because honestly that is a major factor. So many women will not notice that their health is slowly declining after their baby years, and so much of it actually has to do with your postpartum care, and your body never actually healthily bounced back, but you don't see it until you're in your late 40s, when it actually had to do so much with the way that your body was healing and not allowed to heal, and not taught that, hey, you actually really have to take care of yourself after birth.
Yeah. Yeah, that 5-5-5 rule, as we like to go, which you just tailor it to yourself, whatever works best for your family. But especially us self-sufficient women that are used to just getting up no matter what happens and taking care of ourselves, the idea of staying in bed for 5 days is unbelievable. But that's also where your support team is going to come in. And for a lot of people who are listening right now, this could be where you're making one of the biggest impacts, is keeping somebody's home space and family taken so well care of that she doesn't need to get out of bed for 5 days. Because if there's nothing for her to do, if she gets out of bed, then she's more likely to be able to stay in bed, to bond with baby, to learn to breastfeed. Every baby speaks a language. You just have to learn it. They actually can tell you if they're hungry, if they're tired, if they need to be fed. It's very slightly nuanced, and staying in bed for 5 days to learn that language makes a huge difference for your health, for baby's health, and for honestly everyone in the home that's having to listen to a crying baby, because that is so, and it should be grating on the human brain. It's that way for a reason, but it's hard. And so being able to stay in bed to rest, to heal from any kind of damage that might have been done, that you need to recover from, and then getting to bond with your baby and really establish breastfeeding is one of the reasons that there's a 97% success rate for breastfeeding at home. And then staying around the bed, same reasons, which basically means please don't do a ton of stairs. Stay in your living space, don't walk a ton. And then around your home for another 5 days. And you can edit that to, I think I need more. There are some cultures that do up to 40 days in the home. Or you can do less if you're feeling really, really good and being inside, for example, is really hard on you if you're used to being outside. I know I had a client that she went for a walk a week postpartum. She was like, I know 5-5-5, but I needed to go outside for a little bit. And I said, great. If that's what your mental health needed, you needed to go outside. Maybe go hang out, in your backyard in a chair and watch your kids play in the pool or something. But that's fantastic. I'm a huge proponent of the 5-5-5 rule.
Yes. And along with that, sorry, my slides keep closing. Yes, and breastfeeding for sure. A lot of times when a mom is getting up and doing too much too soon, she puts herself at higher risk of infection postpartum as well, and a higher chance of things like mastitis, because she should just be in bed in a robe and diaper and nursing her baby. And if she's wearing all these clothes and going out and not paying attention to her baby's feeding cues, then you're introducing more risk for those things.
Stay at home. Being in your own germs, that lowers the risk of infection by so much. Just being in your own home is huge. And then just basic hygiene. Wash your hands. Keep clean sheets. Keep the house clean. If you're going to give birth in your own tub, wash it with vinegar first. I mean, just basic hygiene practices. It doesn't have to be anything crazy. The reason the hospital has to be crazy about it is because it's not your own germs. And no matter how clean they are, they're still not as clean as your own home. Your chance of infection increases dramatically when you leave your house.
Yes, hospitals are full of bad bacteria.
Also, care for baby postpartum, as far as, the hospital wants to give your baby a bath within the first 24 hours, versus at home, why not wait 2 weeks? Is the baby or a year, whatever you want to do. But in the hospital setting, if you are soap and water washing off your baby, that is removing their microbiome layer, and you're exposing them to the environment and whatever is in the air in the hospital. So actually the vernix on the baby when they're born, the like white cakey stuff, it's even better to rub that in than wipe or wash it off, because that is a protective layer for baby as well. So I know that we were talking about mother, but important for baby too, to keep their own protective microbiome.
Yes.
The birthday frosting.
Yes. And as far as infection prevention from the midwifery standpoint, there's precautions that we take in your home, as far as like that we're gloving, the way that we're cleaning your birth pool, and using, sterile technique when appropriate, and those kind of things are ways that we are reducing the chance of infection. But also, on that note, there's studies that show a really, really strong correlation between how many vaginal exams are performed in the hospital setting and the fact that those significantly increase the chance of getting a uterine infection the more vaginal exams you're getting, especially after your water's broken, which hospitals love to break water to help things progress faster. While at home, we want to be more hands off and leave well enough alone and just let things progress normally. And like Kristen said about the visual cues, we don't need to check a cervix to know where somebody's at in labor the vast majority of the time. And so we are more, we're trying to reduce exposure to those interventions that do have risks.
Some hospitals like to say every hour on the hour, we're going to do a cervical check, which doesn't make any sense. And that is a lot of bacterial introduction, especially for long births over a long period of time.
Absolutely. Did that answer your question? So we're going to dive a little bit into choosing your support team and what different roles are, and particularly in the home birth setting. Starting with the role of a midwife. So a midwife is providing the more medical side of care, as far as assessing to make sure everything's going well with mom and baby. You can see in the picture, there's a blood pressure cuff on. Midwife's listening to the baby with the Doppler to check the baby's heart rate, because that's one of the ways that we check in to see how baby is tolerating labor. And if things are outside of normal, then that can be a reason to go into the hospital. And so, like we said earlier, experts in normal, we're able to quickly recognize when are veering off course, no longer normal, no longer appropriate for a home birth. And so we are prepared to manage a variety of complications at home. And I brought my midwife bags here. This is just some of the supplies I would bring to a home birth, and has emergency medications like for managing hemorrhages, has suturing supplies if there was a tear that we could suture at home, and IV supplies if a mom was needing fluids, and a variety of other things. I have my resuscitation equipment, would be trained in neonatal resuscitation protocol, along with my birth assistant that would come with me. And so those are some of the ways that we are prepared to manage complications.
Complications are a lot less likely to happen at home. Just throwing that in there. Like when we're talking about tears, I was a hospital doula for 6 years, and I saw tears all of the time. A lot of my clients ended up needing suturing, and some of them tore what's called 4th degree, which is all the way through the bum. Because they have epidurals and they can't feel, or there's an emergent situation, we have to pull this baby out, that was created from the environment that they were in. Versus at home, pushing on your back, flat on your back, I would like to say, curled up like assisted is
in the hospital.
In the hospital on that hard bed. Oh my goodness. I had one home birth and one hospital birth, and I can tell you which one I was more comfortable at. At home, I think I have seen a total of 3 people in the 2 years that I have been a student midwife assisting actually need stitches, and both of those were like, we could do it. Do you think you can stay in bed long enough with your legs closed? And they were like, no. And we said, thank you for your honesty. We'll go ahead and get this fixed out for you. So we have these things, we train in these things, and also we are much less likely to need these things
Yes.
because of the environment that you're giving birth in and because of the education and the nutrition that we're doing prenatally.
It would be very, very rare.
Incredibly rare.
Yes, most midwives have never done an episiotomy.
Right. Maybe
Go ahead.
one in your entire career.
You've really contrasted home birth versus hospital birth. I'm curious about the tension exists if there are complications and you go into the hospital, what the hospital staff thinks, and kind of your thoughts about that. I don't know if that makes sense.
Yeah,
How
that's
do
a
you
great
balance that?
question.
How do you engage those relationships with the medical staff, but also still, I guess, support the home birth side?
Totally. Yeah. We love to have the hospital when we need them. And thankfully, it's not so commonly that we need them, but they have a specific skill set, especially surgery and medications. And there is a time and place for those things. And so we're very, very grateful. As far as our reception at the hospital, just depends on who's there and their
Depends
biases.
on which one we go to.
And so we are always wanting to facilitate better relationships, better communication. Actually, just yesterday, Centerpoint Hospital in Independence invited our home birth midwives to come to a meeting to help discuss a smoother transfer process and continue to build those relationships and talk about how this can look better and work better and promote better outcomes for clients. And so, unfortunately, none of the OBs showed up. It was just the nursing staff. They were lovely, but the more that we're able to connect with, especially a lot of OBs have preconceived ideas about what a midwife does and doesn't do without actually having a conversation with a midwife. And so having better perspective of like, we've got a pretty decent perspective about what they do, but they might not see like what we're actually providing as far as care. And so that can be a challenge. Go ahead.
So I am beyond my birthing years. I wish I had known this at the time with my 3 children, but I do have 2 daughters-in-law, and I'm curious, and I don't know what the range is, but is it sometimes your service is covered by insurance? And for people who do not have insurance, what is it? I'm thinking, is this something that I could gift to one of my daughters-in-law?
That's
Good question.
beautiful.
Did you have something you wanted to add to the first question? We'll
Sure.
dive into that.
Really quick. Also, we have techniques for people that when we get there, we've never met that staff before. One is become best friends with your nurse. They're actually a lot easier to win over most of the time because they're going to be the persons that's spending more time in the room. And then they're taking that conversation that you're having and bringing it to the doctor. We also send all of our labs and paperwork over beforehand. And so when we chart, we use MedSpeak so that when they get it, they go, oh, this person actually does know what they're talking about. So our charts that we're sending over is going to be in a language that they understand. So that we've earned a little bit of trust, or at least maybe a little bit of respect before we get there. And so doing that even before we arrive is really helpful. And then also using MedSpeak with them when they're in the room and then translating what they're saying shows a really good depth of understanding and joining in those conversations. Even if they're coming in and saying, I have this kind of a diagnosis and you don't agree with it, you at least let them know that you know what that diagnosis is and its criteria and why you think it doesn't fit, and have a respectful conversation. And by the time you leave, you can actually have ended up what started with a pretty negative, they had a pre-misconception, that turns into, oh, these are actual medical professionals that have medical training. As far as the range goes, I'm not sure of the whole, do you know the range?
Are you in like
What area?
There you go. Okay. Yeah, in
Yeah.
Michigan, they have licensure available for certified professional midwives. And so when in states that there is licensure available, then some of the times it is covered by insurance.
Mhm.
And so that's something that's definitely worth looking into. In places like Kansas, they don't currently offer licensure as an option for certified professional midwives. And so we don't have the option to be in network with insurance, and so it's typically around $5,000 to $6,000 for comprehensive care. Go ahead.
Which that's much cheaper than hospital birth, by the way.
Yeah.
It's usually cheaper. So I work in maternal fetal medicine, have for 15 years. So as soon as I heard, oh gosh, home birth, I gotta beat this one. But speaking to the biases is I will tell you right now, any perinatologist, any OB, if they hear you want to have a home birth, they will try to talk you out of it. So it's unfortunate because there are a lot of high risk, especially now in today's health, right? So it's important still. And I don't know what you guys recommend for like the prenatal care, ultrasounds, all that kind of stuff. But basically, I've worked with probably 15 perinatologists through my years. And if they say, okay, well, they've had an ultrasound, or if they've built a relationship with certain midwives. There was one in Colorado that unfortunately tried doing too many high risk, and they had a lot of negative outcomes. So then that, of course, really soils that mentality for everybody in the area. So then you have a good midwife team that doesn't have any bad outcomes, but it's soiled by that bad apple that tries to do too much. But speaking of biases, it's unfortunate because I'm a sonographer specifically, so I'm all for at least getting checked out between 20 to 24 weeks to make sure there's no previa or anything like that. I'm like, heck yeah.
We are too.
Good. I love it. Thank you. I have some where it's, we have patients that don't want to come in, period, but the midwife actually said, hey, you're measuring really small, we need to check this out, and they ended up having a full placenta previa. Mommy and baby could have died if she, hadn't heard that. But I can tell you, most of the medical field are not for this. It's a very deep indoctrination in the medical field. So I get a good paycheck, but it's really hard on my side I have to feel out my patients,
Right.
Don't lay on your back, guys, you got this,
Being in the system, do you see that there is mortality there? I mean, the home birth side, it's easy to pick out and be like, oh, they did bad, but it seems like the hospitals can kind of cover some of their tracks.
Yeah.
Is that true?
Oh, yeah, and they're so easy to blame it on other things.
Right.
Right? And so they won't admit to the infections, or, they won't, and they don't like midwives or doulas coming in because they have a set schedule of what they want to do. Like, why are there so many quick, I wouldn't say, so field demises are astronomical right now. But yet we have the most prenatal care possible now in the hospitals. I have the fanciest machine out there right now, and I can see everything inside your baby's. I'm sorry, I'm taking over. Preach, girl. It's really hard because you can feel the indoctrination no matter where you go in the hospital. And I have to say it that way because it really is. They're so blinded by any alternative. And they're not even alternative. They're medical too.
Yeah. And the only thing that the hospital system usually sees are transfers, or when things are not going well. They don't know and see how often it goes so well.
Something wrong going on. Yeah. They look at it as it must have been from the hospital.
Yeah. I can throw out an example story, but I don't know if we're doing that. Okay. A client of mine just had a baby a few months ago, and the baby was not peeing and pooping after birth. And so you only give that a certain amount of time, and then baby does need to go to the hospital to be checked out. So they were at the hospital at Children's Mercy, and the OB found out that they had a home birth and admitted them, even though the baby in the hospital being checked out, having some putting pressure on the abdomen and everything, finally started peeing and pooping. The OB was judging the home birth aspect of it and admitted them, and they had to stay for several days. And all of the nurses that were seeing them at that point were like, we don't know why you're still here. We don't even actually know why you were admitted, but it's because of one OB judgment call because of home birth, and horrible experience.
I just was thinking when you were talking about there's this lovely Monty Python clip that I think you all would enjoy. It's the Miracle of Birth one, and it's about in the birth then there's all of these machines. Oh, the director's coming. Get out the most expensive machine. Oh, get the machine that goes bing, and just going through all of this equipment. And the gal's laying there on the, what do I do? And the doctor says, nothing, dear. You're not qualified. But it's a great little clip. I think you'd enjoy it. Yes. So just, yeah, all the fancy equipment doesn't really compare to the normal process. Yes. So.
I was born in 56. My doctor, the hospital, the amount of time we stayed there was like $200. When they start going to the hospital, I was all my aunts and uncles were all home birth.
Yeah. I mean, it's only recently that people started birthing in the hospital, really. Well, our country had a much broader smear campaign for midwives in like the 20s, 30s, so on, where they really painted all of the midwives that were attending births as uneducated women, and were just like, come to our fancy sterile environment, have your babies there. And it was a very, very successful smear campaign. And initially, there was no improvement in mortality for moms or babies at all, because it wasn't actually improving their care. It was just a really successful smear campaign.
It's actually really interesting if you go back and look at people who could afford hospital birth when it first came out, and their statistics get worse. And then you look at people who couldn't afford hospital birth when it first came out, and their statistics stay the same. You just look at the charts, and it's pretty dramatic.
Yeah, and so really the improvement and later was due to better like sterile technique and those kind of things as far as improving outcomes. Just better understanding of bacteria and viruses and all that kind of thing.
With this, he could not stitched up my finger on the farm.
That's awesome.
We just happened to be in the hospital when I was born. So.
Yeah, and initially, like when it was doctors like having their own practices and creating their own schedules, then that's a more positive environment than when there's a director of the hospital who's looking at that bottom line and how can we make more money here. And with insurance complicates things, and so it gets all kerfuddled with all the where does the money actually go, and how many people does the doctor have to see to be able to make the kind of money that they would have made otherwise without all that overhead.
Yeah.
I was old enough and he birthed us.
That's awesome. Yeah, one of the biggest money makers in the hospital is the NICU.
To add to that, I was gonna say, hold on, come right back to me. It'll come back.
You'll think of it, and we'll come back. Sounds good. So my mom had 6 home births out of 7 births. My brother was actually born at home with my brother was born at home with an OB who attended birth. Sorry.
Sometimes if you wiggle that a little bit,
Okay.
we'll write it out.
Okay. So the OB caught babies at home, in the hospital, and at a clinic. And so, yeah. Angelica?
Yeah, I do remember.
Okay.
So I was just gonna say that hospitals have to make decisions based off liability. So they're looking at, they have procedures set in place. Okay, if a mom has been in labor for this long, if her water breaks and nothing happens for this long, that automatically means this. That automatically means this. They're not looking at what they do is your individual body, which every birth is so different and unique, and every mom is so different and unique. And so they're following the actual signs of your body and of your baby, and they know
oh, that baby's perfectly fine. That baby's perfectly okay. You are perfectly okay. You can go far beyond the hospital's 24 hours or whatever because they understand your personal body, not just going based off of liability. So the OB is not saying, hey, your baby's in danger most of the time. They're saying our liability policy says you need to be admitted and we have to start Pitocin because you've hit the 24-hour mark. Not because anything's wrong and not because you actually need it. So.
All right, let's dive into.
Can I ask a question?
Go ahead.
Which you're probably going to dive into. What would you say to women who have had previous pregnancies with complications? How do you know which of those clients you can take on, and how do you determine that?
Yeah, each midwife is going to have a slightly different conversation, but ask a lot of the same questions. There's some things that most midwives would automatically rule out as far as risk factors. A lot of it's individualized that would automatically risk out. For example, in my care, I wouldn't take somebody that had a blood clotting disorder. So that's one example. Definitely, it would be harder to find a midwife for somebody that's had more than 2 cesareans. Let's see. Yeah.
If you're pregnant with like triplets or quadruplets or something like that, then that would be a little bit more difficult. But for a lot of complications that people think would risk them out, actually doesn't. And a lot of times, if you have complications, we're open to co-care, where you see both us and your doctor to get their high level of tests and monitoring, and then you can still give birth at home. Or if it turns out that the complication is exacerbated in pregnancy or gets worse with nothing to do with your pregnancy, then we can go with you to the hospital in the same way that we would if you had risked out during labor. But most of the time, people who think that they're going to risk out actually don't.
And so it's always worth having a conversation with a midwife, even if you're like, I don't know if, this condition is still going to be an option for home birth, then it's always worth having a conversation and talk those things through. Because like MFM co-care is always an option as well. Like some people might need additional scans or things like that. Yeah, midwives fill out the birth certificate info.
And you can opt out of the Social Security card if you want to.
Do not recommend, but that would be a conversation. Yeah. Let's dive into doula roles. I'm going to let them take it away.
Okay, so I'm a doula. I'm not actually a midwife. But it's often confused what a doula does versus what a midwife does. A doula does not typically have medical training. I am not delivering a baby unless I'm just the only one there and the midwife is on her way. But otherwise, I am not supposed to be delivering a baby. The doula provides physical and mental support to the mother, more hands-on. What? And emotional. Helping her get through tough moments, providing counter pressure methods, things to, try to ease the pain as much as possible, take the edge off a little bit, reminding her that this is all normal. This looks very normal. You can keep doing this. I am here with you. Those kinds of encouragement to help her keep going. I am called before the midwife is called so that I can help then start communicating with the midwife. She's looking great. We don't need you yet. Okay, yes, actually, it sounds like we do need you to be here now. I can help the client determine when it is a good time to call for the midwives as well.
So one of the reasons that you would want to call a doula before a midwife is because once we arrive, then we need to start monitoring you as far as like blood pressure and listening to your baby. Those are things that are very important to us. And so if you're not at the point that you need that yet, that would be a good time to call in a non-medical birth professional who isn't going to be doing those things. She's never going to be doing any medical things for you. And also, I've been both. I was a doula for 6 years, and I'm like 2 months away from finishing my training to become a midwife. And I would say one of the big mental shifts for me, which is a good way to kind of differentiate the two, is I had a baby born that needed a couple puffs of air with this after the baby was born. And I turned to do the puffs of air, and the doula turned to the mom and started explaining to her what was happening and asked the dad to come up and start rubbing her shoulders so that she wouldn't be so concerned. And I thought, there's the difference. I needed to get this baby breathing. That's what mom wanted me to be doing, right? She didn't want me to come up and say, I'm going to start. She wanted me to immediately start working on baby and counting those breaths. But it was wonderful to have that doula to turn to her and say, this is exactly what she's doing, which I would have done later if there wasn't a doula there. But I couldn't do it before because I needed to do it right then.
Yeah, midwives love doulas, and I wouldn't want to birth without one.
The doula also is educating the mom prenatally, like maybe depends on, they can offer all sorts of birth education courses, but can be very extensive prenatal classes to prepare the mom for birth, or it can kind of be like a mini course, just depends on the doula. But they are working with the mom prenatally, educating, preparing, and then in labor, the doula is reminding the mom it's good to change positions. You don't want to just be like laying in your bed the whole time. Movement in the pelvis is good to help keep baby like working their way down and through the pelvis, and reminding the mom of like, you need to keep drinking, you need to keep eating, you need to keep peeing, emptying your bladder. All of these things, they're not medical. I can help do that. And that's just going to help her birth go a little bit smoother maybe, but it's that way she doesn't have to be in her thinking brain of, I know I need to be in a squat, I know I need to try a lunge, I know I need to go sit on the toilet. The doula can be that thinking brain for her and help give her those tools and ideas of things to do to keep moving labor along.
And I would say that a doula is even more important to have for somebody who's having a birth in the hospital setting, to help a more positive and well-supported experience in the hospital.
There's a lot more advocacy that has to happen in the hospital from a doula's perspective. I know that the midwives that I'm working with at home, it feels like a same team. We're all on the same page. We're going to support the mother. But in the hospital setting, the doula kind of has to protect the client from the medical staff, especially if they're not really aligning personality-wise or system-wise, trying to protect the mother's headspace and physical space sometimes from and advocating for her when she's not able to advocate for herself and say no to the things that you know that she doesn't want.
Yeah. Plans anymore. Yeah. So if you walk in with a birth plan, they'll toss it in the trash. So having it's bad. And so having a doula to be there while mom is frantic and in pain and stuff like that, to be able to be like, she wants to be on her side, or let's try this. You're walking, talking.
In that case, the doula is the birth plan. She is knowing like each of her clients. She's knowing each of her clients' individual preferences, whatever differences they might be or similar, but she is the birth plan at that point, knowing what her client is wanting and reminding the hospital staff.
Because we were at sea, his sister had a baby, spinal tap, which is necessary, and they did it wrong, so they filled her with drugs trying to get her out of the coma. The baby got the drugs, they delivered the baby, they set the baby aside, they worked on saving the mother, the baby died. They had all the equipment. You were in the hospital. Yeah. Really sorry to hear that. Yeah. Sometimes in my head, sometimes in my head.
Yeah, but even harder when it's a preventable situation.
Same thing happened. Oh, sorry. I had a friend who had the same thing happen, and so when I had my first child, in those days you didn't have as many options. I told my husband, your job is once the baby's out, you follow that baby. You follow that baby and you make sure they are armed with baby My second daughter didn't breathe right away. She had the cord, and so he was right there making sure, and it all worked out. But yeah, you need more than just her in there, and you need even more than just the two of you in there, because there's so much going on. So fully support what you all are saying.
Yeah. And I love to be a doula hired to take some weight off the husband's shoulders sometimes in situations like that. I do like to remind the dads, you go over and be with the baby. I will stay with the mom, with your wife. I lost my train of thought. But yeah, that the dad doesn't have to be the doula in that moment of birth. Like, we don't want to clamp the cord right away. You know, that he's like, we don't want an episiotomy. We want immediate skin to skin, so that the dad doesn't have to remind the mom to, or the staff to do all those things. He can be present for his child's birth and enjoy the moment rather than having to have the doula jobs too. So I like to be hired for those reasons as well.
Yeah. I love this conversation with everybody. I just realized we have like 5 minutes left, and so we're gonna speed things up a little bit. As far as birth partner, just Maggie just briefly touched on that. Doulas do not replace, the husband in the birth setting. They're really an asset to the birth partner, and it is very important that the birth partner be educated and supportive as well to have a positive experience. And so those are things like the Birth Partner book I recommend is a great resource. This is a list of other providers that can be supportive during pregnancy and birth. Love chiropractors, lactation consultants, lots of good stuff. Touching on children at births, I'm highly supportive of them being there. If they are ready for that, and if mom's ready for that, then I wasn't present for my mom's other home births, but being in that environment where birth was a normal event, not a medical event. You go to the hospital if you're sick. Pregnancy isn't an illness. And so that can help set up the next generation for the kind of mindset that we should have about birth.
My family, we bring all of our kids into the birth space. All of my nieces and nephews are going to see this baby be born. All of my my kids have seen their cousins be born. And I was at my sister's birth like a few years ago, and I remember her second oldest, he was 8. He turned to the youngest of his siblings and he said, "Okay, mom's going to go into her room and she's going to get in a pool. And then she's going to go, ugh, and then we'll see the baby." And I was like, that's beautiful, because he is going to grow up to be the most wonderful support person in his spouse's birth. And that's what we want. That's how we take care of ourselves. We experience these things. We grow up in taking care of our own selves, our own ownership mentality. And then he knows that women can give birth and that his future, he's going to be the best advocate. And I just thought that was amazing.
Yeah, it really is wonderful. All right, you want to give a overview?
Yeah, really quick. One of the best ways to prep for birth is to have really good nutrition. A lot of people will say get down whatever you can in the first trimester, and yes, but also when I was told this with my first child, the only things I could get down was brownies and strawberries, and so that's all that I did. And that did not set me up for being healthy in my pregnancy, and that actually ended up being really hard for me. So I'm not going that far. But I do like to say, really, really focus on your protein intake. They say between 80 to 100 grams of protein in your pregnancy. But I want to be honest with you, I don't think that's enough. I think we need like closer to probably like 120 to, I need 160 of my weight. But if you're not a person that's going to count your protein, just make sure that you have protein in every single meal and snack. You should be consuming it all the time. If you're not a huge fan of eating those things, or you have an aversion to things with protein, you're not big on the beans and the nuts and the meats, collagen peptide can be really great because it just dissolves in whatever, like you can add it to a smoothie and then drink it. And my husband calls that his magic protein dust to help me actually get to 160 grams a day. We're going to want to get minerals in your system through pregnancy. Really big that a lot of people don't think about is iodine. And you don't have to get iodized salt for that. You can eat seaweed And they make seaweed chips, which are fantastic, and you can get those down in pregnancy and in first trimester even. When someone says, eat a cracker, it'll help make you less nauseous. Eat seaweed chips. It'll help make you less nauseous and will actually up your minerals so that you're not as nauseous in the first place. Ginger, peppermint, those things are all going to be really great. In later pregnancy, focusing on things like add some alfalfa in. That's going to be really helpful. Iron-rich foods. Your iron stores are going to drop because your blood in your body, you get more of it, about a third more. And so we expect to see those levels drop. And so you bleed when you give birth. Totally normal and natural. But to help your body with that, you're going to want to have higher iron storage. So if you're already cooking in cast iron, A+, keep doing that. If you're using stainless steel, get a little cast iron frog. They make them. Put it in while you're cooking. They're fantastic. And then have those iron-rich foods. That's going to be fantastic. The leafy greens, red meats are going to be fantastic. That vitamin K is going to help you clot. So we want to have foods that are going to be richer in that vitamin K.
Yeah, awesome. And moving your body is important for a lot of reasons. Let's dive into some basic birth supplies. This is basically the max amount of trash we make at a home birth, even with the birth pool liner and everything. But on this slide here, I broke down the barest of bare bones as far as things that might be helpful to have on hand if all of a sudden you're going to catch a baby. Towels, these are going to be important, like to dry the baby off after the baby's born. Chucks pads are a great thing to have for that bleeding postpartum. Having a bowl for the placenta. These things, love for birth, especially if it's a really fast birth and that baby's about to pop out. Just throw these side on the bed, on the floor, wherever, and have a baby there.
Yeah, it is. It's a waterproof tablecloth. It's so much more comfortable than a tarp. Tarps are fine. Plastic shower liners are fine, but they stick to your feet and they make noise, and moms get really annoyed if they're moving around and it starts sticking to their legs. So this is really helpful. And you can just spray some hydrogen peroxide on it to clean it off, and then you've got a tablecloth.
Or trash, either way. But one of my first clients that birthed this had a 35-minute labor. I missed it by 5 minutes. And
hey, that's not bad. That's not very much. That's not a lot of time.
She did not want to mess with the birth pool because she had a history of fast labors, and so the instructions were throw this on the floor to have your baby. And so, I mean, this is pretty much all she had for her birth. But I mean, I was there 5 minutes later. But great thing. As far as if you're wanting to have some things on hand as far as preparedness, since you won't be able to get your hands on the same kind of medications, don't really have the training for the medications that a midwife would administer, having tinctures, like this one's Hemholt and this one's Placenta Ease, having these on hand could be a helpful option, especially in a pinch where you don't have access to other options. And so tinctures. What? Oh, tinctures, they're herbs and alcohol, basically. Which herbs are in it? Yes. So this one's Hemholt. It's got herbs that help the uterus to contract and stop bleeding. So if a mom's having excessive bleeding after her baby's born, then this would be a good one. If placenta is taking some time and you have reason to get it out faster, might as well try the Placenta Ease tincture to see if that's going to help the placenta release and come out.
Even for really fast births, like what she was just talking about, where the client gave birth and was on the phone with her, so she's kind of walking the partner through what to expect. The midwife is still going to most likely, we rarely miss placentas. And so that final stage of birth, where we're going to be there with all of the meds that we're talking about, that's where a lot of the now, like, are we bleeding excessively or things like that after birth, that it becomes important to have a medical professional to be there and to check for clots. You can be laying down thinking that you're perfectly fine, then you stand up, a bunch of clots fall out, and suddenly your blood pressure tanks. So you want us to be there to say, hey, actually don't do that. I've got these other things I'm going to do to check for that first before you start moving around.
Yeah. Coping tools, always helpful. There's a lot of things like combs that you can squeeze in labor, having some provide counter pressure, using water, whether it's a birth pool or a shower or something, is a great way of using a coping tool. And then diaper for mom, diaper for baby. Yeah.
They match.
Okay. Crash course in baby catching. So one of the first things, let's see here.
Yeah, if you're
Like,
sitting
where
on
do
the
I start
toilet,
here?
which we jokingly call a dilation station, and you feel the urge to push, please get off of the toilet.
Yes, I was very recently, and I was sitting on the toilet, and my husband said he reached down there, and he was like, I felt hair, and it wasn't yours. Go lay down.
Yes, slow gravity down. Yes, lay down, get off the toilet. I actually recently had I've always said if you are laboring on the toilet, then you can just stand up to birth your baby. I take that back. I had somebody about 6 months ago sitting on the toilet, and she did not realize that she was giving birth to her baby. She was just in her own space, and her husband was in a different room, and then she literally just birthed her baby into her toilet and then just started saying, it happened. And he was like, what happened? She's like, the baby. So we said it's still a water birth, but get off the toilet.
Yes. And then lying on your side or hands and knees can help slow delivery a little bit more and reduce the chance that you would tear or your baby hit their head on the floor. But yeah, those are great positions. And having the midwife on speakerphone is really helpful. Not rushing to bring the baby to your chest, because if they're all wrapped up in the cord or if the cord is short, you don't want to scoop them up and then either tighten the cord or snap the cord, which that is possible. Don't want to do that. So you're going to be slow. Next, you would feel for a cord around the neck and body and gently unwrap. Not a big rush to unwrap your baby. And it's like a third of babies have a cord around their neck. It's super common. Very, very, very rarely a concern. It's very normal. And some would say protective to prevent the cord from being in a place that's not supposed to be, because that's a normal place for a cord to be.
We like to say that the babies that are born fast are generally not the ones that are going to be having the cord accident, because the cord is going to slow their descent. So generally, we're going to make it there before that happens.
And then bringing babies skin to skin after they're unwrapped and keeping them warm, because wet babies get cold really fast and you want to keep them nice and warm. And skin to skin, because the really neat and magical thing is that moms' bodies actually regulate their baby's temperatures. Nobody else's bodies do that, but the first few days postpartum, the mom's body will actually adjust to what their baby needs. And so that's pretty incredible.
Yeah, they get a localized fever on their chest to warm baby up if baby is cool. And then they actually get cold themselves if baby is too hot. It's just the most amazing.
Moms with twins have been shown to be different temperatures based which each baby needs. Yeah, pretty incredible. So helping babies breathe, obviously, we have different kinds of equipment than you would have in a pinch. But just briefly drying and stimulating the babies, first and most important step, because typically that's all baby needs. Some babies are just going to come out screaming. Some need a minute. But giving them a minute to orient themselves and take that first breath, because that's a pretty big first breath, because their lungs have never been inflated before, and it even changes the circulation in their bloodstream with the first step. Should we?
I want to show something.
Yeah.
You guys know how to help a baby?
Just push a baby up.
Yeah. Oh, we'll just give birth. That's so cute. I haven't seen that before.
Yes, this is my purple polka dotted perineum. But
that's adorable. So if your baby comes out and is not breathing, and they've been, laying there for probably like 30, 45 seconds and still hasn't taken a breath, you can take them and just like with children that are choking and turn them this way on your hand and give them those pats and then help them spit up whatever is keeping their lungs from inflating, and you don't need any tools to do that. Don't do it too hard, but nice little 45-degree angle, couple pats, flip them over, stem, and then they'll take a breath too.
And I also added on here about properly supporting the baby's head and neck, because sometimes a baby will be born and they don't have a lot of tone and their neck's down like this, and it's really hard for them to take a breath. And then when you straighten them up, then they'll take their first breath.
When you take the baby and bring the baby to yourself, a lot of people do this. Don't do that. They need to breathe. And they've never done it before. You want them to tilt their heads back, hold them like this. Look at their cute faces. You want to see them anyway. So much easier to breathe with your head kind of tilted back than it is leaning forward.
Yeah. One of the things that's most gotten wrong by people who call EMS for a fast birth is the advice to clamp and cut that cord right away, because that is completely unnecessary, because that baby is receiving their oxygen still through their cord until it stops pulsating and the placenta detaches from the uterus. And so this is giving that baby oxygen typically until they're taking their first breath. So we're not going to just cut that off right away. And so that's something that is important information.
And that's actually how their body is used to getting their oxygen. So they process it better through the cord than they do room air for the first minute of life. So we want to leave that so that they can get all the oxygen they need, even if they're not inhaling at the time that they're born. It's very normal for babies to be born blue, because when they're in utero, they're at about 70% oxygen. And we don't expect them to come up into the 90s for a few minutes after they're born. That's totally normal. And for their hands and feet to stay blue for a bit.
Yeah. So if your baby, you did the initial steps, they're not breathing, then that would be a reason to help your baby breathe. In your case, you're probably not going to have something like this. You would just have your own mouth and lungs to cover your baby's mouth and nose. And you really want to be super gentle with those breaths, because those lungs are tiny. You don't want to pop them, which is very possible. Like if I was to put this on a baby, give a full squeeze, that would be too much. Just tiny puffs of air, just enough to get that chest to rise, is how much a baby needs.
Barely. Just very small puffs.
Yes. Hopefully you don't need to do that. All right, as far as hemorrhage management, the first two steps are actually preventative steps, not really things that you're gonna during an active hemorrhage, but keeping the bladder empty is one of the easiest ways to prevent a hemorrhage, because a bladder that's extended makes it harder for the uterus to contract down and stop bleeding. And so during labor, you want to make sure you're emptying your bladder frequently, so that's not an issue after your baby is born. And nursing your baby soon after birth, that stimulation also helps your uterus to contract. The most common cause of postpartum hemorrhage is the uterus not contracting down well and effectively. And so that's why that's the biggest focus. Obviously, having help on the way. If you're going to manage a hemorrhage, guiding the placenta out is one of the most important first steps. Here, Maggie's going to be our model for placenta delivery here. So you might have a Chuck's pad down there. She's got her baby. She'll want to squat down, because squatting is a great position to deliver a placenta. A lot of times the gravity is going to be enough that if she's bearing down, she'll hopefully be having some cramping and be able to bear down, and then she can guide the placenta out. Go ahead and see.
You give it the same amount of force for the ladies in the room as pulling on a tampon string.
Yeah.
Gentle
and
guidance.
So,
and then you're going to go kind of down and almost like a little bit back to kind of guide it down.
And then after that placenta is delivered, if there's any concerning bleeding, can give the uterus a good rub to help it contract as well. But that's a good position to have a placenta in. Baby's still attached, baby's still skin to skin, all good things. You're good.
Once baby is born, you do not stay in the squat. What I kind of joke with some of my clients that give birth on the floor, I say you can lay down on the floor, you can get on the bed, but you can't stay here. So no longer in the squat. At that point, you're wanting to recline.
Yes.
Yeah, we do.
As midwives, we check out the placenta and make sure it's all intact. Baby's side of the placenta. This is mom's side of the placenta that was attached to the uterus. And so you can see there's a lot of lobes. We don't want to leave any of those behind because that's also a cause of bleeding and infection.
It's one of the reasons that I say gentle traction. You don't pull too hard, because if you have one node that's still attached, and that's why it hasn't delivered yet, if you pull, you can leave it behind, and then that's a whole lot harder to deliver after that has happened. Having it all come in one piece is much better.
Yes, and a lot of times, like I said, with the gravity and just bearing down, hopefully that gravity is enough to help it pop on out. Obviously, taking an appropriate tincture would be an option, like Hemholt here is an example. Some people actually would say that cutting off a hunk of placenta and putting it in your cheek is an option for helping stopping a hemorrhage.
Power of the mind here again. Literally just telling your body to stop bleeding and tell your uterus to cramp. I don't want to sound crazy here, but our brains are really, really powerful. And sometimes just telling your body what to do, like you're talking to a naughty toddler, can be helpful.
So those are some of the basics. Obviously, like from a midwife standpoint, that management might look a little bit different. But in a pinch, if midwife is on her way or something, then those are the kind of things that you would want to know. And that is all our slides for today. But yeah, want more questions?
Some time ago, we won't go the dates, but there was a big emphasis on dad and mom taking what was called back then Lamaze classes, so that everybody in the team knew what kind of breathing you need to do when. And I haven't heard anything about Lamaze in a very long time. So is that still something that is promoted or put to the wayside or what?
I don't know of anybody that still does Lamaze. Bradley would probably be the closest comparison. We encourage childbirth education for both partners to take comprehensive childbirth education, because really knowing what to expect, and this is not childbirth education here. You want something much more comprehensive to prepare for your birth with your partner.
Yeah, Lamaze does a breathing, which we now know puts you into a stress response. So you are telling your body that it is panting, that it's in trouble, and that it needs to release cortisol and get all of those muscles tight. And so we have learned that you need to do really, really deep breaths and never hold your breath. Really like that, low tones versus the high tones that come out when you're going and you actually cause yourself to panic by doing Lamaze breathing, which is why we don't encourage that anymore. But instead, we still want everybody who's going to be attending the birth to go to the childbirth education class, but we're teaching them really deep inhale and almost like a growl coming out, which sounds kind of funny. But I will literally come and stand next to somebody who's starting to get higher pitched fast breathing, and I'll just breathe deep next to them and just next to them, and then they mimic me to do that deeper breathing. And that's more of what we encourage now instead of the Lamaze.
Also, the longer breaths, the longer inhales, the longer exhales can help you like relax your body more and relax your muscles, because otherwise if you're hyperventilating through your breathing, you're more likely to be tense and have a tight pelvic floor. But there's a connection between your jaw and your pelvic floor. So if you can drop your jaw and relax your jaw, most likely you're loosening here, relaxing there, so that baby can hopefully come through a little bit easier. So there's that mind-body connection from here to here.
All right, next question.
My interest in this stuff came from a very offbeat place. I used to, in my 20s, be a scuba diving instructor out on the West Coast in this very high volume facility where we had huge classes in very rough seas where we took them for their checkout weekend and all that stuff, open ocean dives. And I would get like pushed to the point of physical exhaustion. I'd be the first one in the water and the last one out. And as I'm hauling myself out, like where I've been in zero gravity, all day underwater, swimming around, pull myself out onto the swim step on the back of a boat in kind of pitching seas, like gravity hits you like a hammer, and you're like, oh my God, one day it hit me like, this got to be what it's like to be born. It's like you're in a zero G environment, you're floating, right? Your muscles allow you to move around and all that. And then all of a sudden, you're pinned under the weight of your own organs like a beached whale. Yeah. And it made me curious. And I discovered this Russian obstetrician. His name was Nicholas Charkovsky with a T. And he was doing these, one of the first people to do a lot of water births. And these kids would develop so quickly and they'd get so strong. So, and it was just a huge difference. So I thought, eventually when I have kids, this is something I'm going to do. And then I met my son's mother. She was a nurse. She was a new nurse, and she would float to every unit in the hospital. So she did time in NICU and in the ER and all this. And when we were starting to have planning having a baby, all I heard was horror stories from her all day, every day. And I had been to a lot of births of family members and stuff. And the thing that I observed there as a fly on the wall, somebody who's not a parent or whatever, but there as part of the family, was like, this is a factory and this is a factory process. And these people just, latch you onto the conveyor belt and run you through. And it's like, I don't want any part of this. Like some rando just taking charge of like my child's birth. And so we decided to have a home water birth. And, when my son was born in 1998, and, he's going to be 28 this summer. And it was just a beautiful birth. Everything went perfectly. We had a 900-gallon pool in the dining room, and I plumbed hoses in. I ran a couple of hoses in through like the heating ducts and stuff, just cut a couple of small notches and ran them up so we could control the temperature perfectly and keep the water level where we wanted it and everything. And everything just went off without a hitch. But everybody would say, aren't you worried about what happens if there's a complication? And, we said that's the whole point, is so that there won't be any complications. We'll be directing the process. Our child is not a factory product. We don't need somebody to weigh him and certify him and stamp some kind of thing on his forehead or whatever, Right. And I couldn't recommend it more strongly for anybody and everybody. It was what's up.
Thanks for sharing.
My next client that has a water birth, I'm going to be thinking about that gravity hit that you said with scuba diving.
Yeah. Another question.
So with the birth classes, especially if you're in the Kansas side, because you guys are from Missouri, right? Yeah. So with the birth classes, if you're trying to get your insurance to pay for them, if you do it through a birth center, not necessarily your OB's office and that sort of thing, because you're going to get the hospital birth indoctrination fear thing. So if you can go to at least a birth center, your insurance should pay for it. But typically, if you go through a doula group or something like that, you can get fantastic home birthing information, but it's coming out of pocket. So if you don't have money for out of pocket for that sort of thing, at least try to go to a birth center, and that'll help you out at least financially and to not be feared into hospital births.
More questions?
I would just say that my only warning about midwifery is that it kind of ruins the rest of medical care for me. Because I now expect that level of informed consent from my doctor, and they don't work with me, and I get frustrated with them because after I started having kids, I can't do it anymore.
Yeah. I know. I look for a doula at the dentist, and I look for a doula when my mother-in-law is going through cancer treatments. I'm like, there needs to be a doula in every specific pocket of medical care.
You know, one time I was having oral surgery, and like I was like so impressed by the doctor's informed choice like video, and I told him when he walked in, I was like, "This is great." I was like, "This is so thorough. Feel well informed." Yeah.
Any other questions? The good thing is you ladies are going to be over with Angelica for the rest of the day, correct? So even if they don't get their question in, you're going to be here for a little bit?
Yeah.
And they're also going to be up here in about 30 minutes to do the podcast with Scott Armstrong. So you'll get a little extra there as well.
About half a dozen of us here are with a group called Autonomy. And part of that is all about, seeing opportunities all over the place, find a need and fill it, and business opportunities. And you just said one like that made me think, like, why is this not a thing? Patient advocates that answer to the patient, like you have a, whether it's a subscription-based thing or whatever with somebody, and they have, different specializations. They can, like, say you could have an agency where, thank you, honey, where, you put together like a team of people, and okay, we're your advocates. If you're going to the dentist, this is your dental advocate. If you're going, for any kind of thing, and man, I could see that just being a huge, huge thing, because it's so hard to get accountability anymore. Everybody wants to just like shuffle the blame or kick the can down the hall or what have you, and man, there's potential there.
Yeah. Of note, there are actually also death doulas who help support people through the dying process, which is a really, really important role as well.
So my question would be back to you. The biggest obstacle I think you would see to something like that would be, how would the insurance companies react? And I know it could be a big deal, trying to battle for the right to take care of your own care. So that would just be another aspect of getting a business like that up and running, is maybe even a legal team to help you. Because I remember the days, I know there's a lot of us silver-haired people out here, there were no interference between you and your doctor. There was no third party. There was no middleman. You just went in there, made the deal with him, and he did the thing in his office. And so that huge bureaucratic invasion is what you'd have to overcome. But I love
and that invasion came in on your provider's side, but there wasn't a counterpart.
Correct.
On your side, and that's what I think we're identifying in the industry.
I think if you could overcome that in some way, it would be fantastic.
Let me know when you do that.
All right, we'll make this one the final one so these ladies can get off their feet for a little bit.
Yeah, I just wanted to make a response and reaction to what Kate was saying. Is that I noticed, there is a movement among people to just move away from the established medical system because it is not working. And people are suffering, they're dying, they're going bankrupt, their lives are having a lot of misery because of it. So there's a movement among doctors to just work on a cash basis, but to charge a lot less. And nurses going to work for doctors where there's no insurance involved. And so this advocacy thing that was suggested, which is an outstanding idea, I never thought of it, but it's wonderful. We could work that into this humanity-based medical system that is developing, that does not have insurance, that, you went to medical school, you deserve to earn a good living, but we can't have our medical system profit-based, the bottom line being the end-all and be-all. So I get excited when I hear about things like that.
Yeah, and there's more alternatives to insurance that are coming out, and that do cover midwifery care and that kind of thing. And so that is also a consideration for people who are wanting a home birth in the future. What if I just opt out of the insurance system and go to an alternative?
Do you know some of those names offhand? Some of those insurance
Well, there's like
carriers?
Christian Healthcare Ministries, Zion Healthcare.
I have Samaritan Ministries. Excellent. And what I love is that the sharing things, it goes straight to the person who needs it most of the time. You know, when we pay into that, actually we're sending it to the person who needs it, and then we'll actually send them a little note of encouragement for why they're needing that. And so every month we get to feed into our community. And you know, last year I experienced a stillbirth, and I can't imagine having to go through that and having to deal with an insurance company. And so getting to go in and work with my midwives and to work with my doulas and the people who were caring for me, and then to have Samaritans supporting me, not in a completely different way, I felt so advocated for and just taken care of, and that was huge. Go Samaritan. Yeah, that's another one.
All right, folks, let's go ahead and let these gals have a break. They're going to be back up for the podcast, or at least a couple of them might be, and we need to let them get some food in them. So let's give a round of applause. Arguably the longest class we've ever had at Midwest, and it wasn't about how to shoot something. So,
Well, it kind of is, though, shooting a baby out.
oh, and earlier you were like, when I decided I was going to have a baby, and I was like, when you decided she was going to have a baby. We let